Hello, my name is Jeffrey Shu, and I'm a board-certified otolaryngologist and head and neck surgeon with additional training that focuses on the function of the throat. I'd like to talk to you today about Globus sensation, which is the feeling of something in the throat. This symptom is very common and has many different causes. Up to 50% of people will feel this at some point in their lives, and it often goes away on its own. Other symptoms people can feel include the need to clear their throat or having phlegm caught in their throat. Others may have neck soreness, a muscle ache in the front of the neck, or a raspy voice that gets worse with more talking. Globus sensation is different from dysphagia or trouble swallowing, which can lead to changes in your diet or cause weight loss, or odynophagia, which is painful swallowing. Globus alone is rarely a symptom of cancer, as cancer will have other warning signs like pain, persistent change in voice, food avoidance due to trouble swallowing. There is no cure-all for Globus, and treatment involves addressing possible underlying causes. One of the most common causes is acid reflux, but other causes include overusing your voice, stress and anxiety, or postnasal drip, which is when mucus from your nose drips down the back of your throat. There are many treatments that patients can try at home, starting with general healthy living. Reducing irritants or irritation to the throat can often help. You can do this by staying hydrated, by drinking plenty of fluids, and keeping the throat moist. Other ways to help include avoiding smoking, avoiding strong odors, and control of allergies through medications, saltwater rinses, or allergy avoidance. Behaviors such as throat clearing, coughing, or straining the voice all irritate the throat as well. Avoiding reflux triggers can also aid with decreasing Globus. Often reflux is worse with spicy, acidic, or fatty foods, as well as eating larger meals or eating later at night. Relaxation techniques and regular exercise not only help with stress management and improve mental health, but Globus sensation as well. Maintaining healthy neck and shoulder posture and relief of neck and shoulder aches with stretches can reduce tension in the neck and lessen Globus sensation. If you do see a primary care provider, treatment is most often directed to what your primary care provider feels is the most likely underlying cause. In some cases, this will be treating your nose with nasal sprays and saltwater rinses, as sinus issues, allergies, or postnasal drip often contribute to Globus. Other times, patients may be placed on reflux medication for 6 weeks or longer. As there is not one cause of Globus, your treatment is directed at what the most likely cause is, and there is sometimes a trial and error process to improve your symptoms. Some clinicians will order tests to see if other conditions are the cause of your symptoms. One test is called a barium swallow, where patients drink a chalky material and an X-ray is taken to evaluate the swallowing mechanism of the throat and food pipe. Another test is a probe that tests for reflux and movement of the food pipe, called a pH probe and manometry. To evaluate your food pipe, you may be referred to the gastroenterology department for further evaluation. If there is a concern for an underlying mass, an ultrasound of the neck or CT scan may be ordered. To evaluate the surface tissue of the throat and voice box, you may be referred to a head and neck surgeon, where an in-office camera through your nose is used to evaluate the voice box and back of the throat area. If you have Globus sensation that lasts for longer than 3 months, even after trying some of the methods we've talked about, then you should be evaluated by a clinician. Similarly, contact your primary care provider if you notice worsening swallowing, which can include, but not be limited to, food avoidance and coughing or choking when swallowing. Other concerning signs include pain with swallowing, regurgitation of food, weight loss, persistent voice changes or hoarseness, which is a loss of your normal voice for longer than 2 weeks, pain, symptoms that are only on one side of your body, lump or bump in the tonsil area, throat, or neck. Your primary care provider will be able to help you get the appropriate treatment for these symptoms or refer you to a head and neck surgeon if needed. Thank you for watching.